Officers of the College, Fellows, members and guests, a very warm welcome to this evening's Honorary Fellowship ceremony. While I am not in Kildare Street physically, as you can see, I'm here virtually. It gives me great pleasure to celebrate the fact that today we are awarding an Honorary Fellowship to Dr Anthony S Fauci, which is the highest honour that the College can bestow. We are not only welcoming Dr Fauci to the College virtually as an Honorary Fellow, we also have the opportunity to hear from him about his experience as an advisor to 7 US presidents. It gives me great pleasure to make this award today. Dr Anthony Fauci is the Director of the National Institute of Allergy and Infectious Diseases. He was appointed to this position in 1984, and he oversees an extensive portfolio of research into the prevention, diagnosis and treatment of infectious diseases. He is President Biden's Chief Medical Advisor on SARS-CoV-2 and the COVID pandemic. Dr. Fauci is a true leader, a public health servant in every way, not just in the US. He has a global presence. Now I would like to ask Dr. William Powderly to give the citation on Dr. Anthony Fauci on behalf of the Royal College of Physicians of Ireland. Over to you, Bill.
President, Fellows, colleagues, an honorary fellowship is the highest honour that the College can confer. And I can think of no one across the universe of medical practitioners and biomedical scientists who is more deserving of this honour in 2021 than Dr. Anthony S. Fauci. In this remarkable, historic and unique year, I can think of no one in our profession who has shown such leadership in spite of unprecedented challenges, both scientific and political. But to those of us who have been witnesses to his leadership of the US National Institute of Allergy and Infectious Diseases for the last 37 years, it is not a surprise to see his response to the SARS-CoV-2 pandemic. What the world has seen is professional leadership, remarkable energy, and an unrelenting commitment to science as a vehicle to improving the practice of medicine and public health. Tony trained in internal medicine at Cornell University in New York and joined NIAID as a fellow in 1968. As chief of the NIAID Laboratory of Immunoregulation, he made seminal observations on the pathogenesis and ultimate treatment of previously fatal inflammatory diseases such as polyarteritis nodosa and granulomatosis with polyangiitis, formerly Wegener's granulomatosis. In 1984, Dr. Fauci was appointed director of NIAID. He took on this responsibility at the start of another pandemic, that of HIV/AIDS, and he oversaw the development of an NIH research portfolio of basic, translational, and clinical investigation that transformed HIV/AIDS from an inevitably fatal infection to one where infected individuals can, with appropriate intervention, have a normal life expectancy. Tony has also overseen NIAID's research response to other infections, such as tuberculosis and malaria, as well as leading the research efforts to combat emerging diseases such as Ebola and Zika. In addition to his administrative roles, he has continued to oversee a highly productive research program on the immunopathogenesis of HIV infection, with seminal observations on the interaction of HIV with the immune system. And remarkably, he also continues to see patients at the NIH Clinical Center in Bethesda. These accomplishments alone are remarkable for any scientific career. But I would like to also mention 2 policy decisions that, in my opinion, have had enormous public benefit. The first was Tony's decision early in the AIDS epidemic to allow the patient voice to be included in decisions regarding research review and prioritization. While commonplace now, This was very controversial 30 years ago, but was, I believe, transformative in framing how we now all realize that research, especially that funded by the taxpayer, must meet the needs of our patients. The second key policy role that Tony played was in the early 2000s as one of the principal architects of the President's Emergency Plan for AIDS Relief, or PEPFAR. This US government program, started by President George Bush, has provided antiretroviral therapy and other AIDS services throughout the developing world and has saved nearly 20 million lives. Over his career, Tony has advised 7 US presidents and currently serves as Chief Medical Advisor to President Biden as he attempts to reimagine the US response to the current pandemic. Tony has been recognized many times by others across the world for his contributions to medicine and to science. And, President, it is my great personal pleasure to provide this citation for Dr. Tony Fauci and to recommend him for Honorary Fellowship of the Royal College of Physicians of Ireland.
Thank you, Dr. Powderly, for that wonderful citation. It gives me tremendous pleasure and honour to introduce Dr. Anthony Fauci to the College. Dr. Fauci, we would like to admit you as an Honorary Fellow, and I would like to invite you to make your fellowship declaration. So if you say after me, I, with your name,
Anthony S Fauci,
do promise and declare that I will well, truly and faithfully attend and exercise the office or place of Honorary Fellow of the Royal College of Physicians of Ireland. In all things touching and concerning the same. By virtue of the authority vested in me as President, I hereby admit you as an Honorary Fellow of the Royal College of Physicians of Ireland. Welcome.
Thank you very much. It's a great honor, and I feel very humbled by this extraordinary honor that you're putting upon me. Thank you very much. I have it right here.
Thank you. We were very organized, thanks to the staff in the college.
I will frame this and put it in a very prominent place in my office, I assure you.
Thank you very much. I'm delighted that you'll do that. I'm going to go right into some questions we have for you. I'm an infectious disease doctor, and you've always been inspirational, certainly in my time in the States and beyond when it came to HIV and AIDS. It's been a particularly challenging time for people in Ireland, as it has been for elsewhere. What message of hope can you give them?
Well, I believe that although we need to continue to be cautious because this virus has surprised us continually with various surges over the last year to 14 months. However, there is light at the end of the tunnel, particularly now that we have vaccines that have been proven to be highly efficacious and safe. To me, this is going to be, as we call it, a real game changer in what we've done. We're starting to see in countries that have just even begun to implement the distribution and implementation of vaccine programs that there is clearly a diminution in hospitalizations and deaths. And we're starting also to see a diminution in the number of cases. However, as we've seen in the United States, the curve is very sharply goes down, but for the last couple of weeks, it's kind of plateaued a bit. I don't think that should cause us to despair, but that should cause us to be cautious that as we continue to vaccinate more and more people, which will ultimately give us control of the outbreak, we've got to remember we can't just completely turn off all public health measures. The only time we can do that is when we have the virus very much under control at a very, very low case positivity. So the bottom line is that there is good news. I think most places throughout the world are seeing a diminution, and as they roll out vaccines, it's going to get better and better.
Most of our members are doctors on the front line. We train people in public health, in internal medicine, and many other specialties. We also have quite an amount of medical research and science going on here. Do you have a message for those research scientists and frontline doctors?
Yes, I do. And to me, it's a very pleasant message to give to them, in that very often the people at the bench and the people who are doing the fundamental basic preclinical and clinical science, they don't get as much recognition when you have a public health issue that ultimately gets solved. But the major, overwhelming success story in this very tragic and difficult outbreak has been what basic biomedical and clinical research has given us. It has been unprecedented in the history of medicine. You were talking about the long and storied history of the Royal College of Physicians of Ireland, but the fact is, if you look at the history of vaccinology, we have never ever seen a situation where you have a new pathogen is discovered in January of a given year, and by December of that same year, you are putting vaccine into people's arms that is 94 to 95% effective and safe. If someone had told me that a few years ago, I would have said that it was complete hyperbole. There's no chance that that's ever happening. And in fact, when we said we hopefully would get the vaccine in 12 months, we were criticized for being overly optimistic, and that's happened. And that's because of the research that was done a decade or more ago, research on vaccine platform design, on immunogen design, on structure-based vaccine design. So it's really a very good day for fundamental basic science.
You know, you've been involved in many pandemics, HIV, AIDS, Ebola, Zika. You've been a big advocate for community involvement, community buy-in. What do you think we should be doing with that particular aspect of pandemic control?
Yeah, we really need to never ever let down on our engaging in the community for any of a number of reasons. Engaging the community to convince them of the importance of the public health measures that we know work. There has been so much unfortunate controversy, and particularly in the United States, unfortunately, where a lot of the public health measures have been politicized, where wearing a mask or not assumes a political connotation, whether or not you congregate indoors at bars and restaurants becomes a political statement. We've got to continue as public health officials to reach out to the community and continue to give them the evidence-based and data-based opinions about what needs to be done. The other thing that we need to do, and this also we saw in other outbreaks, is that we need to reach out to people who have reluctance and hesitancy about getting vaccinated. Vaccination is essential to the control of this outbreak. And even today, we still have people in the United States who thinks that this is a hoax and it's fake news and it's just people making things up with conspiracy theories. We have 527,000 deaths in the United States right now. I mean, just think of that number. 500,000 deaths thus far from this outbreak. This is the worst public health disaster that we have had in a confined period of a year in over 100 years, since the 1918 pandemic of influenza. So we really do need to reach out as best we can to get people to appreciate the importance of following public health measures as well as getting vaccinated.
Usually at the end of the day, pandemics are controlled or they're eradicated. So that's the hopeful message that we'll bring once we can continue to bring people along with us. What lessons have you learned in the last year that you'd like to share with us?
Well, I mean, it's been an extraordinary experience. And the reason it is multifaceted, but one of the things that struck me is that we all of us throughout the world, were watching things in real time evolve, and we had to respond. But we had to respond with the information that we had at the time. But as I'm sure you recall, the information evolved and changed, because I remember the first day I heard about this was New Year's Eve, December 31st of 2019, when Bob Redfield, the director of CDC, called me up and he said something very strange is going on in China. They have an unusual pneumonia in the Wuhan district that they say is associated with the wet markets. Immediately, everybody thought it was SARS-like. We didn't have the pathogen yet, but we thought it was SARS-like. But the information was that it jumped species, but don't worry about it because it's animal to human. All of us got very concerned because there were 24 cases, and it would be extremely unusual if one jump would be 24 cases. And then they says, well, it might be spread from person to person. And then a week later is, well, it is spread from person to person, but very inefficiently. And then it was, well, it spread quite efficiently from person to person. And then it was, there's community spread, and it might be spread by people who don't have symptoms. And then a few weeks later, it's predominantly spread by people who don't have symptoms. So we went from thinking we had something that would not be explosive to something that was devastatingly explosive. So the lesson is you have to keep an open mind, and you have to change your viewpoint, your recommendations, and your guidelines based on the information you have at a given time. And right now, we have the information to know how important it is to abide by the public health measures. So keep an open mind, go with the science, and if you have to change, let data and evidence be your guiding post for change.
I'll follow up on that, I suppose, is what do you think that science and medicine will benefit from this hugely impactful disease? You said more than 500,000 people dead in the States, but I suppose every cloud has a silver lining, so there must be additional science, additional medicine, diseases that will benefit from this.
Well, just like every other outbreak we've had, going all the way back from HIV, which opened up for so many of us in science and medicine, I'm sure yourself included, an understanding of the complexity of the regulation of the immune system. I think understanding the fundamental pathogenesis of this disease, which I still am puzzled by in some respects. I mean, how an infection which has killed 525,000 Americans and has killed over about 2.3 or 4 million people worldwide, can have most of the infections be essentially asymptomatic. And young people essentially get very, very little involvement. Obviously, there are some that do. Is that I've never seen a virus or any pathogen that kills so many people, that has so many people who are without symptoms at all. I mean, usually a devastating infection that can kill 500,000 people in one country makes most people at least a little bit sick. But we have, 40 to 50% of the people who get infected don't get any symptoms. So we have so much more to learn about the pathophysiology of not only this particular virus, but also the aberrant inflammatory response that this virus triggers, which is the modus of exit of many people. It isn't the virus itself. At least the patients that we've seen who have really had very severe disease leading to death, it's not the virus in the last week or two that kills them. It's the aberrant inflammatory response the hypercoagulability, a whole variety of other things. So we have a lot to learn.
Do you think we could have been better prepared, given that it's another respiratory viral pathogen?
You know, I get asked that all the time. And the fact is, you could always be better prepared. But I think one of the things that I've learned, and I keep learning, even though I've been doing this for such a long time, is that no matter how well prepared you are, you're always going to be faced with unanticipated things that happen. And that's exactly what I was mentioning a little bit ago. You know, I have had to, because of my position in the United States government as a health person, I've had the opportunity to interact a fair amount with our military, particularly the Joint Chiefs of Staff, General Milley. He actually is Milley. General Milley told me when I went to the Pentagon to talk about how we could exchange information about how they might best protect their troops. And we were talking about just the same question you asked. And he said, you know, when we go into a war or a battle, we have a very, very precise battle plan so that we are extremely well prepared. And then when the bombs go off and the shooting starts, forget the plan. Everything is the fog of war. And planning is important. It isn't that it is not important, but you've got to learn to be very, very agile when the action starts. You know, in a war, it's when the explosions occur. In a public health situation, is when you have these overwhelming surges of infection that tend to kind of evade a bit the precise planning that you did.
I'm going to quote you about a global pandemic requires a global response, and how important it is as a country in Ireland who do a lot of overseas support in resource poor settings, how important that is in controlling a pandemic. Not, we could say selfishly for us, but it is essentially a global response that's required, and how we can best do that.
Well, no doubt about that. I mean, I think that's one of the things that I hope we get more and more involved in that now. Not only a global response in things like what we still refer to as the global health security agenda, where you have interconnectivity, transparency, cooperation, collaboration, all the things that one needs to have a unified global response. But the other thing that is a bit more difficult is, how do we get the entire world vaccinated when we have a vaccine? It's important not only because from a pure humanitarian standpoint, the way we did with HIV and the PEPFAR program and the Global Fund, that a person, a country, a region should not suffer disproportionately because of where people were born. They happen to be born in a country that doesn't have the resources, that doesn't have the capability of doing the things that developed nations can, that it's the responsibility, I believe, almost a moral responsibility for those of us in the developed world to make sure that there is some equity, some global equity with regard to interventions that are life-saving, in this case, particularly vaccine. It's important not only because it's our responsibility, as an interconnected world, but it also is almost enlightened self-interest. Because if you suppress the outbreak in Ireland and we suppress it in the United States, and there's raging infection in lower and middle income countries, sooner or later a variant is going to come back to our country and obviate the effectiveness of the vaccines that we're using. So it's to our advantage and to everyone else's advantage to make sure this is truly a global response.
Can I ask you just about the long-term impacts of SARS-CoV-2 and COVID? What do you see are the major issues coming down the track that we should be preparing for?
Well, again, when you talk about the uniqueness of this outbreak and you compare it to other outbreaks that we've had to deal with, this has been completely and totally global. This has shut down our planet for over a year. So if you could name every aspect, economic almost destruction, which will take a long time to get back. The fact that we had to neglect other diseases because we were focusing on an outbreak. In the United States, they did some modeling about the increase in cancer and cardiovascular disease deaths because people don't go to a physician to get checkups or follow-ups, interruption of drugs for HIV, people who are living with HIV, and then the mental health impact on our children. I mean, we've had a year's worth of children either not being going to school or being very patchy and intermittent in getting in-person schooling. If you look at other things, child abuse because everybody's confined to their home, suicidal rates, mental health rates, this outbreak, besides killing so many people and maiming so many people, has had secondary spin-off effects that we're going to be dealing with for a very long time. This is not going to just go away when we get everybody vaccinated. We're going to have an economic recovery that's going to take a while. I mean, there have been businesses, many businesses, I'm sure the same in Ireland, that have closed and will never return, even though we have this $1.9 trillion relief package that we put together. There are still, which is great. It was wonderful that went through. But there are some destruction that is now irreversible. So it's been a very, very bad time for this world.
From my end of things, you've been an inspirational leader, and my days of training and practicing in the States when it came to HIV and AIDS. You've been pragmatic, you've been calm, you've had to make difficult decisions, as you say, with the evidence that's available at any period of time. When it comes to leadership, what advice do you give to our younger generation of doctors and indeed medical researchers on the path forward, on how they can make an impact?
Well, for the younger physicians and scientists, the thing that we need to hold on is to our fundamental principles of integrity. And we are scientists, we are physicians, we have a responsibility, in some respects more than in any other field, to make sure that data and evidence drive what we do, that we are consistent, that we never ever compromise our integrity by not going with the science and the evidence, either ignoring it or distorting it. It's ingrained in the profession we've chosen. We've chosen a science-based profession, and therefore science needs to guide what you do, and the evidence and the data that you accumulate, you have to abide by that, and you have to be consistent and always be truthful. Always. I think the distortion of reality that has occurred with this outbreak has been frightening. I believe likely in the United States it was more pronounced than in many other places because of the divisiveness that we have in society. But as a scientist, it's been particularly disturbing to me to see an extraordinary and egregious distortion of reality. Just hang on to the truth, no matter what the forces are that are pushing you and pulling you in different directions. So that would be my advice to our younger colleagues who are in the early stages of their career or who are planning to enter into our very wonderful profession.
And I suppose my final question is going to be, do you have any regrets?
You know, the answer is no, I don't. I don't. I mean, I totally recognize my fallibility and the fact that I certainly am not perfect, but I don't have any regrets for things. I did what I felt was the right thing to do. I would do it over again. It's been an extraordinary experience. We learn by our mistakes, and we all make mistakes. So in that regard, no, I don't. I think we all have to go through what we go through, and we just do the best we can.
Thank you for everything you've been doing for us globally, not just with SARS-CoV-2 and COVID pandemic, but certainly with HIV and AIDS. And I can say that on behalf of all the patients that I have looked after in the past and continue to look after. So, Dr. Fauci, congratulations on becoming an Honorary Fellow of our great college. Please keep up the good work. Keep up that calm, reassuring, science-based communication that you do for all of us.
Thank you very much. Thank you, Dr. Horgan. I really appreciate this. It's a great honor, and thank Bill Powderly for connecting us. And I will try my very best to visit you. As you may know, I have an Irish-American wife who wants very much to take me back to the land where her great-grandparents were born. So I'll try my very best. I look forward to meeting you there when I go. Thank you again.
Thank you very much, Dr. Fauci.
Bye-bye.
We've reached the end of what has been a wonderful event. I hope you enjoyed it as much as I did. Dr. Fauci is now part of our global community of 12,000 doctors across 90 countries. Our fellows are among the leaders of health service and the medical profession, not only in Ireland but around the world. This is your professional network. Don't be afraid to use it. Never stop listening to the science. Never stop being curious, and never stop learning. Thank you.
It was the early summer of 1981, and the CDC, they reported 5 men who presented with a very unusual kind of pneumonia. And then 1 month later, 26 men with not only this strange pneumonia, but this strange kind of cancer. And the thing that blew me away is that all of them were gay men. And I said, whoa, something is going on here that's really bad. It was very clear that this was something we had never seen before, and it was completely unpredictable. And I made what I considered the transforming decision in my own career. I was going to stop what I had been doing and devote myself completely to studying what I felt would be an enormously difficult disease. In a well-meaning way, my mentors thought I was being foolish to go after something that they thought was going to disappear. Many people in and out of government were considering this just a fluke among gay men, that's some strange disease. And unfortunately, my concerns were well-founded.
There are 5,000 new people infected every single day.
There was a lot of resentment. The idea of activists playing a major role in some of the decision and policy making in a research program was completely foreign and antithetical to many scientists. We don't need to involve the community in this, and I thought that that was not a good idea because the community had a lot to offer.
Tony knows what to do. His hands are just tied behind him and his feet. Every time Tony wants to go to the toilet, 10 committees have to vote about giving him permission. That's why there's not a cure for anything.
In the early 80s, if someone came into my clinic with AIDS, their median survival would be 6 to 8 months. Now, I could accurately predict if you take your medicine regularly, you could live an additional 50 years.
Governor, today they may call them role models, but they used to be called heroes, the kind of public figure who could inspire a whole generation, someone who was larger than life. Who are the heroes who are there in American life today?
I think of Dr. Fauci. Probably never heard of him. You did. Ann heard of him. He's a very fine research, top doctor at National Institute of Health, working hard doing something about research on this disease of AIDS.
It became clear to me that the public needed to be educated to understand emerging infectious disease that would generate a lot of concern on the part of the public. That could be HIV/AIDS, that could be pandemic flu, that could be Ebola. And I was perplexed by seeing that scientists who shunned away from trying to explain things in plain English, they spoke over people as opposed to trying to get people to understand. When you're dealing in the interface of politics, policy, and medicine, the thing that I have found to be very effective is be consistent, be totally honest, and don't tell people things that you think they might want to hear. Tell them the truth based on scientific evidence.
Doctor, you want me to get you into this political mess?
No, I don't want you to do that, but I will. My job is that I'm a scientist, I'm a physician, and I'm a public health person, and I don't like to get involved in that stuff. So anyway.
Even though they may not be happy with what you tell them because it disappoints them, they will respect you if after a while it's clear to them that you're telling them the truth. You've got to do that balance where you can make the person feel that they really understand what you're talking about. Be clear. Don't talk down to them. Don't feel that because you're a scientist, you're so superior that you could talk over their heads. They will like that because people like to learn. They'll feel good about that. They say, well, I've learned something today. That's how you can be successful in getting good science to drive policy. I don't sleep much.
It's really 4.5 hours a night?
Yeah. About 5 at the most.
No doctor would tell you to only get 4.5 hours of sleep.
You get used to it, and that's it. And you wake up and you're fine. I do that. I work a lot of hours. I work most of the weekend. I don't do it as a drag. I do it because I like it. I'm very interested in people. I'm very much of a people person.
Larry and I have had conversations about this many, many times over the years, and I appreciate and in many respects admire the rage that he has about a very, very difficult problem. But I think you have to
start that business about science isn't done that way. I'm going to come down there and slap your face.
All right, Larry, hang on for a second. I love you, Larry.
The most important thing is to understand and appreciate what you're doing and the importance of your work. Humanity and goodness to mankind and doing the right thing and the best thing and the most appropriate thing. And to me, that's medicine.